So let's talk about why the patient experience is really important. So if you follow a lot of my teachings, the patients care about two things, okay? They care about results and they care about the patient experience. All this other stuff is kind of off to the side, but the two most important things of what patients care about is results and the patient experience. So I'm going to tell a quick story. So I got to experience what a business experience or a consumer experience is like, where my tire pressure gauge in my car was out and I had my little check engine like emergency light that was on for months, and it was just so annoying and so annoying over and over and over again. And I really just wanted to get it fixed, but I didn't have any time. So for months I kept seeing my emergency light up. And it just got to a point where it was so annoying. I was like, oh, I finally just want to get this taken care of. Just like many of our patients are doing that same thing with pain and injuries, whether they're waiting for it to go away or trying treatments or just on time. The pain is, like the pain threshold is starting to go up, and then they're sick of it. Now they'll call and take action. So I was going through that same thing. So I finally called up this like auto tire place to finally get my sensor light replaced. It's an easy job. It's like $150. So I finally get in. I'm taking time out of my day on a weekend to drop my car off. I drop my car off. They end up telling me that it's fixed. Okay, imagine this same experience going through with some of our patients. I go through the experience, I drop it off. They say it's fixed. Okay, and I go pick it up. I'm like super happy. I'm ready to go. I'm like, okay, great, I'm fixed. And I go to my car, and my pressure sensor gauge is still on. That little, I was like, this is ridiculous. I was like, excuse me, sir. I was like, I just got in my car and my pressure sensor light is still on. He's like, oh, just drive around for like a couple miles and see if it resets. Okay. So I go drive around for a couple miles and it's still on. And I pull back in. I was like, guys, it's still on. He's like, oh, sorry, you may have to drive around for like a day. And then if it doesn't go off, then come on back in tomorrow. So I'm like, oh, this is a perfect example of where we need to set expectations of what the patient should expect as they come through your doors, as they experience treatment with you. It's super essential to guide that patient on the phases of rehab or what to expect, so they know what to expect. They should have told me that, the pressure sensor gauge is going to be on for the next couple of miles, so I don't get upset and disappointed. Because the feeling that I felt when I got back in my car, I turned it on, and the pressure, that annoying thing was still there. I was like, what the freak? I was like, this is insane. So anyway, I drive around for like a day, and the pressure sensor light is still on. So I have to take more time out of my weekend to drive back there and get this done. So again, it's going back to results and the patient experience. So far, they failed with the results and they're failing with the patient experience. Now, I end up going back on a Saturday. I dropped the car off. In a matter of 5 minutes, they were able to adjust the sensor and it ended up going off. Okay. Now, I'm probably not going to go back to this place. Yes, they finally fixed it, but it went through all that hassle that they finally got the result, but it wasn't what I expected. If they would have walked me through the thing, maybe I would have been okay with that and I'd go back there again. But let's make it even better. What if that next day, that manager there called me and say, hey man, I just want to check in and see if your light sensor was still on. He took time out of his day just to shoot it, even a text. If they would have texted me just to check in on me, letting him know, I was like, wow, that guy actually really cares. So what if I would have gotten a text on Sunday or a phone call of them checking in on me just to think about if my light sensor's on or not? That one little move may have kept me going back there forever, maybe. Okay, it's the same story about the $40,000 text, which I'll tell you in another video. This is why the patient experience matters. Sometimes during an eval, or someone's going through an event or they're in a flare-up, shooting that patient a little text after the eval or after a hard week, letting them know that you truly care about them, that those little touch points and those little patient experiences is what really matters most. So again, you could suck as a physiotherapist and still have a great patient experience, and patients are going to come to you. Optimally, you want the best of both worlds. We want to deliver excellent results, which I can't help you with. That's more about your training and skill set. but I can help you with the patient experience. Okay. And doing, the two main things here of this video are, make sure you're setting expectations for your patients of what they should expect when they walk in the door. What should they expect during the evaluation? What should they expect after the evaluation? What should they expect with treatment? And walk them through the phases of recovery, or walk them through the next steps so they know what's going to happen next. So you never run into that same problem that I had at that tire store, and we got to deliver results. But that's stuff that I can't help you with. So again, this is why the patient experience is very important, and in combination with the results. And then we can go through strategies and touch point integration to highlight, and give our patients the best patient experience possible. So that's it for today. I'll see you guys on the inside.